And I'm really intrigued about the fact that you guys are proactive in reaching out to folks. Can you talk a little bit more about the health share exchange and working with hospital staff, perhaps, in referrals?
Sure, yeah. So when we first started doing this work, electronic health records were not like a thing yet.
Mm-hmm.
Um, and hospitals certainly couldn't see each other's electronic health records.
Mm-hmm.
And
Yep.
so we created a platform that allowed for us to see and allowed them to basically exchange data if they had a shared patient. So
Mm-hmm.
this isn't just looking at any data, but looking
Right.
at someone where there's a shared patient and there's obviously a consent process
Sure.
and all of that. Um, but um, but that data is used by us to really work with our health systems to identify, to say who is in need right now,
Mm-hmm.
um, that maybe we're missing when they
Mm-hmm.
show up at
Mm-hmm.
the health system. And here's another example. Um, Hundreds, thousands of people who show up in emergency departments and they're having some kind of mental health issue. And that mental health issue might not be, so we would call it acute, such a crisis that they need to go to a crisis center, but they're
Mm-hmm.
still really having a hard time.
Mm-hmm.
Well, you know, emergency departments don't schedule follow-up mental health appointments. That's not what they do. Emergency departments are there to help you right now figure out like how to basically stabilize you, and they're amazing. I mean, emergency room staff are amazing. So one of the things that we did was help our partners figure out how to use that data of people showing up in emergency departments with a mental health problem,
Mm-hmm.
um, to reach out to them,
Mm-hmm.
um, quickly, to say, how can we help you get connected to mental health services? So that's just another example of how we use data.